Now, the Australian Institute of Health and Welfare released new data this week highlighting the increase in the diagnosis of endometriosis amongst Australian women. The rate of hospitalisations for the conditions has also doubled amongst women aged 20 to 24 over the last decade. Joining me live now for more on this is consultant and nutritionist Kelly Richardson. Kelly, thanks so much for your time this Saturday morning. Now, as someone who does have endometriosis, I was diagnosed a couple of years ago, felt like I was suffering in silence. Can you firstly explain to our viewers exactly what this condition is?
Yes, of course I can. And first of all, sorry that you've experienced an endometriosis. It's not a very nice condition. So endometriosis is something that some women will experience. And what happens is cells that line the uterus, they actually grow in areas outside of the uterus. So this can cause areas within the pelvic region to actually join together and fuse. So it can cause very painful scarring of the tissues, symptoms such as bloating, discomfort in the pelvic region, and heavy menstrual bleeding as well.
Now, how important are these latest new research findings?
It's really important because what we know is that endometriosis is on the rise. Now, we're not sure whether this is due to actual levels of endometriosis rising or whether it's because more people are aware. So more people are talking about it, doctors know more about it, and we're also able to diagnose it much faster.
Run us through some of the diet changes young women can make to lessen their endometriosis symptoms.
So for some women, we can make some dietary changes that can show some positive effects on the symptoms of endometriosis. So first of all, a diet higher in polyunsaturated fatty acids. So those are omega-3s. So if you think about oily fish oils, but then if you're looking at more vegan, vegetarian options, that could be flax oil, hemp seeds, walnuts, omega-3 fed eggs. Other things that you can do is include foods that are high in anti-inflammatories. So think about fresh leafy greens, fresh fruit and vegetables. And then finally, high fiber foods have been shown for some women to actually improve the symptoms. So by getting the bowels moving nice and smoothly, it can clear up a little bit of that inflammation and bloating in that area. So with high fiber foods, we want to think about nuts, seeds, legumes, and then fruits with a seed in. So think about blueberries, raspberries, strawberries, and kiwis are also really good to help that digestive system run nice and smoothly.
Lots of areas. And now, how many of your clients suffer from this condition? And do you think it's becoming more common?
I have a large number of women that suffer from endometriosis, and diet is something that we work on together, diet and exercise, and then also meditation and breathing as well, just to help with the mental load that comes with having endometriosis. Are numbers on the rise? Yes, I think they are. But again, I think it is because we're talking about it more, and that is so important. So we're talking to our friends about it more. We're going to see doctors about it more, and we're realizing that it's not normal to feel like this. It's not normal to be in pain, and it's not normal to have a chronic condition.
And lastly, do you think the state and the federal governments, I guess from a political point of view, are doing enough for endometriosis awareness?
I think with anything to do with female and our reproductive systems and our mental health, I think we always need to be doing more. So I think there is a lot that is being done, and I think it's great that we're talking about it more, but I think that more could be done, yes.